Hello and welcome. Today we will discuss and understand about depression, a condition affecting millions globally. We will cover its type, causes, symptoms, and treatment options, all in an easy to understand way. First of all, what is depression? So depression is more than just sadness. It's a mental health condition characterized by persistent feelings of sadness, hopelessness, or anger. Unlike temporary mood shifts, depression deeply impacts one's daily functionings. Types of depression. There are several types of depression, each with unique symptoms. Major depressive disorder, for instance, involves intense sadness that affects everyday life. Persistent depressive disorder or dysthymia is milder but is longer lasting. Bipolar disorder includes depressive and manic phases. Bipolar disorder includes depressive and manic phases, while seasonal affective disorder relates to seasonal changes and postpartum depression affects new mothers. Now, talking about symptoms of depression, symptoms of depression vary widely. Emotionally, it can manifest as sadness, irritability, or feeling of worthlessness. Physically, depression may cause fatigue, changes in sleep, or appetite shift. Behaviorally, people mildly withdraw socially or lose interest in activities they once enjoyed. Causes of depression. Uh, Depression arises from a complex mix of factors. Biologically, genetics or brain chemistry imbalances can play a role. Psychologically, traumatic experiences or specific personality traits might contribute. Socially, loneliness or a stressful environment can trigger or worsen depression. Risk factors. Several risk factors can increase the likelihood of depression, such as a family history of mental health issues, significant life changes, or trauma, substance abuse, or chronic health conditions like diabetes or heart diseases. Impact of depression. Depression affects not only mental well-being but also physical health and society. It can lower self-esteem, strain relationships, and increase the risk. And it can cause loss of productivity. It can weaken immunity and relationships. Diagnosis. Depression involves a mix of medical evaluation, physical exams, or lab tests help rule out conditions with similar symptoms. Neurotransmitters are examined just like serotonin and dopamine levels. And mental health professionals use psychological evaluations and questionnaires to assess the condition. Treatment options. There are multiple ways to treat depression. Therapy, such as cognitive behavioral therapy, CBT, or interpersonal therapy, IPT, helps modify thoughts patterns. Medication like SSRIs or SNRIs can also help balance brain chemistry. Lifestyle changes, very important, such as regular exercise, a balanced diet, and stress management also play a vital role. Self care and coping strategies. Self care is essential in managing depression. Practices like mindfulness and meditation can help calm the mind. Staying connected with loved ones provides support, and setting small, achievable goals can provide a sense of accomplishment and control. Supporting someone with depression. If you are supporting someone with depression, it's essential to be patient and listen without judgment. Encouraging them to seek professional help can make a big difference. Avoid minimizing their feelings as they may worsen their isolation. Seeking help. If you or someone you know is struggling with depression, don't hesitate to seek help. Mental health professionals, support groups, and helplessness are available. Helplines are available. Early intervention is crucial to managing depression effectively. Remember, depression is treatable and recovery is possible. And with the right support, recovery is possible. Reach out, stay informed, and support yourself and others in maintaining health conditions. And last, thank you for watching. For more videos, subscribe and follow us. This was a short video. Inshallah, we will meet with a long description, and we will discuss it into Urdu language so that our audience can also learn it easily. Thanks for watching.